Good evening and welcome to a People for Effective Government online event. I'm PEG member Mark Kinney, and I will be co-moderating tonight's event along with PEG board member Eric Coltrane. Good evening, Eric. PEG is a nonprofit, Spokane-based, nonpartisan coalition. Its mission is to support approaches to governing which are fiscally responsible, ensure an adequate social safety net, and promote a civil society. We've held in-person public forums and online events like this one for more than 3 years. PEG works to encourage sincere and civil discussions on the challenges that face our nation and seeks to promote effective solutions to these challenges by presenting public forums on a variety of relevant topics. We like to provide this disclaimer. The views presented by tonight's guest speakers are their own. As a 501c3 nonprofit, PEG neither participates in political campaigns on behalf of or in opposition to any candidate for public office, nor engages in political activity of any kind. For our audience, you are welcome to submit brief questions at any time via the Q&A feature of Zoom. Please limit your questions to 2 or 3 sentences. You may ask several questions, but please submit only one question at a time. Our speakers will answer as many questions as possible before we end the forum around 8:30 p.m. Tonight's event is being recorded and will be posted on our website, which is www.pegnow.org within a couple of weeks. Tonight's forum topic is homelessness in our society, and our panelists represent various local organizations which provide services to our homeless neighbors and work to solve the complex problems that contribute to homelessness in our community. And now I'm pleased to introduce this evening's speakers. Karen Stratton is a Spokane City Council member representing District 3. Her community involvement includes numerous boards and commissions, including the Spokane Neighborhood Action Programs and the West Central Community Center Board of Directors. Welcome, Karen. Dr. Rob McCann is president and CEO of Catholic Charities, an organization that provides 1,300 units of affordable housing and a variety of other social services. Welcome, Rob. Ben Stuckert is Executive Director of Spokane Low Income Housing Consortium and Chair of the Spokane Regional Continuum of Care Board. Ben was Spokane City Council President for 8 years. Welcome, Ben. Thank you for being here. Chud Wendell is Executive Director of the Hutton Settlement, a home for orphaned children. Hutton currently houses over 56 children and young adults and has served over 1,600 children in the history of the settlement. Thank you for being here, Chud. Edie Rice-Sauer is Executive Director of Transitions, a local nonprofit that works to end poverty and homelessness for women and children in Spokane. Edie, thank you for joining us. And finally, Chris Patterson is a Community Solutions Advisor for Washington Trust Bank. He's the founder and CEO of Breakthrough Incorporated and founder of Steadfast Supported Living Incorporated, which seeks to support clients to and through self-sufficiency and independence. Thank you for being here, Chris. Our speakers tonight bring a breadth of experience on this topic, so let's launch the discussion of homelessness. I'd like to start by reading from the City of Spokane's website a couple of their homelessness frequently asked questions. The first one is, what does homeless mean? You'll get a chance to address this, but according to the website, the Department of Housing and Urban Development, HUD, defines homelessness in 4 broad categories. First, people who are living in a place not meant for human habitation, in emergency shelter, in transitional housing, or are exiting an institution where they temporarily resided. Number 2, people who are losing their primary nighttime residence, which may include a motel, hotel, or a doubled up situation within 14 days, and lack resources or support networks to remain in housing. Number 3, families with children or unaccompanied youth who are unstably housed and likely to continue in that state. And number 4, people who are fleeing or attempting to flee domestic violence, have no other residence, and lack the resources or support networks to obtain other permanent housing. I think those will be familiar to many of you and the people that you serve. And finally, who's at risk of becoming homeless? It's often thought that veterans, people with disabilities, and single parent families are most at risk of becoming homeless. However, the reality is that today, an increasing percentage of the country's working poor are struggling with or at risk of homelessness. In fact, according to a recent MarketWatch survey, most of the population is one missed paycheck away from becoming homeless. People recently released from prison and young adults who have recently been emancipated or aged out from the foster care system are also at increased risk of being homeless. So to the panel, having heard those, the description of who's at risk of becoming homeless and the definition of homeless, what do you think about that? And how does it square with the folks that you serve? And that's for anyone who wants to jump in.
I'll just, sorry, Carrie, and say that sometimes those definitions fail to acknowledge the day-to-day experience of children. You know, those children who bop around from school to school and home to home and couch surfing. And so I think sometimes those are really sterile definitions and we forget the reality behind the people that experience that day to day.
True. And on the topic of children, Judd, that's specifically who you deal with at the Hutton Settlement. Tell us a little bit about that work.
Yeah, okay. Well, Hutton Settlement's a children's home, and we serve, today's population isn't necessarily orphans, we'd call them social orphans. And they're children that would have faced severe trauma, whether it's being pulled out of homes, homelessness, or issues where their parents might have facing addiction issues or incarceration. And we are a long-term care provider where the children will provide care for, and with the hope of reunification or adoption. But in today's world, that's not as likely. And so oftentimes the kids will stay with us throughout until they graduate high school. But yes, we do care for the children. We're on a long-term basis and not necessarily the big numbers that Edie talked about.
Right, I mentioned 56. Sorry, I mentioned 56 in your bio. Is that about where you're at for a census?
You know, right now we're 34 between the ages of 5 and 18, and then we have a caseload of another 14 that are 18 to 24. So we keep them on our caseload when they transition out and become adults. Okay,
so do you specifically have a program to transition them out to a successful independent state?
We do. We have case managers that we have funding in place for scholarships, whether it's 4-year, 2-year trade to transition them out. And we have case managers. Then we also have housing in the event that they stub their toe, need help, need to come back with their family. In some cases, when COVID hit, when they were shut off, you know, when colleges were shut down, they didn't have anywhere to go. So they ended up back with us on their campus.
That's a good point. And I direct this to Rob. You serve, I'm just guessing you serve the predominant homeless population in Spokane at Catholic Charities. Is that correct?
Yeah, you know, actually we serve about 75,000 different people a year at Catholic Charities, but the reality is I almost always only talk about the 1,200 or so homeless people that we serve, and rarely talk at all about all the other programs for seniors and kids and families and farm workers and the disabled and veterans, because really it's mostly about homeless. But you know, we obviously run a lot of big shelters. We have a lot of housing that's specifically for homeless populations, whether it's families or singles. You know, and that number, you know, is a little over 1,000 out of that 75,000 that we serve with 15 different programs. But homelessness is the one I talk about the most, and sometimes it's the only one I talk about.
It's certainly the most visible, but I think most people do know that Catholic Charities is a huge presence in Spokane and does good work in those other areas that you mentioned. So thanks for that. And Ben, tell us about what you're doing right now. You're on mute, Ben.
God, 2 years later, and I still can't remember every time. Apologies. I guess on the young adult and youth side, we're an anchor community initiative, and we just received, the city and the Continuum of Care just received 2.5 million for a youth homeless demonstration project from HUD. And I think we saw 6 months of decreased young adult homelessness in Spokane. And that was specifically because we implemented with the Anchor Community Initiative case management of individuals. And so out of the homeless information system, we're able to produce by name lists and know everybody who they are in the young adult system. And then monthly, the providers get together and case manage them. We just started doing that with veterans homelessness as well, and we're moving into doing that on singles homelessness. But I think what that really goes to show me is if you put the resources in and you focus on them as individuals, you can get the services and get decreases over 6 months, which is statistically significant when the overall population is increasing. If we're seeing a decrease in young adults due to the way we're doing it, we need to be replicating that throughout the system.
Great. So you're a consortium, and does that connote that you are working with a variety of different folks?
Yeah, and I guess I was talking from my board position as the Continuum of
Continuum
Care.
of Care, okay.
And then the consortium is made up of all the agencies in town and banks and architects that work on low-income housing. The struggle with low-income housing is starting in the 1970s and 80s, low-income housing dollars from the federal government got slashed by 75%, and we've never made that up. And that's when homelessness really started to become visible countrywide, when those dollars were slashed out of the federal budget and we stopped focusing on low-income housing as a solution. And so now you're piecemealing solutions together, and so then you're relying on market rate rents. And we know from July of 2020 to July of 2021, rents increased in Spokane by 29%. Every $100 in rent increase equals a 6% increase in the homeless population. And that's, so we can't keep going on like this where we're not dealing, and that's market rate housing. So we can't just approach this as a low income housing got slashed and we need to build more. We do, but we also need to control how much rents are increasing in market rate rents and how hard it is to get into ownership, because that's how you build wealth. And so we need to be looking at our housing crisis as a continuum, and how do we increase supply across the board so that these rent increases aren't going to increase our homeless population.
That seems like a good time to go to Karen Stratton, who's a city councilor. What do you think of what Ben just said?
Well, I agree. Ben and I have had many conversations about this issue. The one thing I wanted to add, I think there's a population that we don't see or we don't want to see, and that is our elders. I had an opportunity a couple nights in a row to go down to Hope House before they moved into their new facility. And I stood outside when they had to check in, and when they were full, there's a line and so many people get in and then it's closed. And the evenings that I was down there, I was absolutely stunned that we had older women, some in walkers, that were homeless. And that to me was just, it just hit me hard that we forget that population is also involved in this homeless issue. And the other population that I've learned so much about, especially a couple of years ago, and we've worked hard to try and change it. I was in a Safeway one night, 11 o'clock, doing some grocery shopping, and ran into a young woman in a car with 2 children. And it bothered me because she was just staying there. And I asked her, are you okay? Do you need anything? She said, I just need a place to live. I have a voucher, but I can't get into an apartment because there are landlords out there that don't take vouchers. So that led us, and Ben was council president at the time, to really work on that with the landlords and the tenant association to say, if somebody has a voucher, you can't discriminate against them. You rent to them. If there's somebody you meet and you collect the information and it's good and they're stable, you can rent to them. So, I mean, when we talk about homeless, there's a lot of different categories of people.
Sure.
And the few I think that have been so hard on me are the elderly, the children, of course, but also that section of individuals who have vouchers, who are working with an agency to get somewhere safe to raise their families, and they're not able to get places to rent. So that's one of the biggies.
Thanks, Karen. Edie, can you talk a little bit more about that and tell us about the work you do at Transitions?
Yeah, so as you said, Transitions is a local not-for-profit started by 4 different Catholic communities, sisters communities, and before 1986, really. And we serve women and children primarily, although we do serve some men. We do that through 3 different kinds of housing programs, 2 transitional, 1 permanent housing program, a job training program in the culinary arts, New Leaf Kitchen Cafe, which is that job training program, and then the Women's Hearth, which is a day center. It's kind of the day shelter for the women who at Hope House at night. And that's a place where we can build community, but also really connect with resources, try to help them find housing, help them find employment. And I guess one of the things I would say is, as Karen pointed out, every situation is so unique, but frankly, 90% of the women we serve are domestic violence survivors. And we have 4 transitional housing units for them in the city. So our work with Lutheran Community Services and the YWCA is really challenging because there's just not the resources for when somebody needs to find housing and find it sometimes really immediately. They're fleeing domestic violence. So that's often how women find themselves in situations where they don't have housing. And they're often then doubling up. So again, those kiddos are in other homes, trying to go to the schools that they're used to and oftentimes not being able to.
Thanks. Chris, tell us about the work you're doing in your role as Community Solutions Advisor for Washington Trust Bank and your other roles.
Yeah, well, for myself personally, growing up in the system, it's been different. I have a different approach. I've been listening to Ben and Karen and Edie and Chud and Rob, and I think that our community, obviously the first thing that comes to mind is treating people with respect and compassion and dignity, which is a big deal. You know, when you're homelessness or you've been on the streets, you've been trafficked, you've been put in situations with domestic violence or alcoholism or drug abuse, all the above, the first thing that comes to mind, I know everybody on this panel has the same agreement. We want to treat them with dignity and respect first and foremost. And having worked in the field for 25 years with, you know, autism, schizophrenia, bipolar, dual diagnosed, I mean, all the really tough populations, I've come back to find, you know, the biggest thing is always it's coming back is the policy that we have. We're working with an effective policy to help the bigger picture. Can we reduce, can we improve the quality outcomes of people's lives? And can we make a bigger mark for that? So when Washington Trust had asked me to come on as what they call a Community Solutions Advisor, it's to really bring the private sector to the table where they maybe have not been before. It's really giving the time to educate them, show them the social service providers, the housing authorities, what they do, what they don't do, show the differences between where individuals are at, where the gaps are in between the agencies, who's providing the duplication of services, where the gaps are falling through, where those kids, the adults, the single moms, all the above, the veterans are facing issues. So that way we can actually say, look, how can we partner with and bring public-private partnerships to a better, stronger position to where we can maximize those dollars federally, statewide, citywide, with the private sectors to actually have a really positive outcome with evidence-based providers who have a good solid track history of doing the necessary thing for our communities. There's a lot of people that want to see things done. And this means bringing all political leaders, all people, regardless of your political affiliation. This is a nonpartisan issue that I've been hired to focus on. And that is bringing everybody together, which is, you know, it's not always easy to do, as most of you will probably admit. And you're going to have different personalities, different egos, different agendas. But I think at the end of the day, we can all agree on, can we reduce the numbers of the issues we're seeing in society? Can we reduce the issues of the social issues of our society we can actually address to really be genuine about it? and not be placating to where we know what we are doing is the right thing, because at the end of the day, it is a living legacy that we will all leave behind.
Great. Have you been seeing some successes in that work in exposing the private sector to what's going on? And if so, in what way?
Yeah, I think the biggest thing is, it's not always about economy for people. They have been touched by social issues, whether their family's been touched by drug addiction, mental health, a father or mother who's been displaced, as Karen was saying, the elderly. I get a lot of questions for even some of the employees of the bank. Hey, can you help me with an issue with my mom or my dad, because I can't find them an affordable place because they're on Medicaid, Medicare, they've injured themselves. We can't afford the dollars that would be to pay for a private place. And how do we do that? And there is HUD dollars there. It is not as easy to find as people think with assisted living or nursing homes. The money that's flowing has really restricted procedures at times, and you want to be able to use it for the right thing. But the business community has been very much open doors. I've been very happy to see what's been taking place. Nobody's shut the door on me so far, which is nice. I'm trying to bring in the Northeast Community Center, West Central Community Center, all the community centers, because I remember as a kid, I was at the Northeast Community Center receiving services quite a bit, or at the Salvation Army or different places that I was a recipient of. So I think that when you have a story to sell that is giving them hope, and that they do believe with the dollars being used, people can actually have a positive outcome, you can help build the future leaders in the vocational programs and the transitional programs and all the stuff that we know is important. And that's what the business community, the private community, the philanthropy, they're all on board to make sure things get done to where they can walk away knowing they invest into something with a solid foundation for a future.
Great answer, Chris. Thank you so much. Now, I know this next question affects all of you. The last couple of years now have been a challenge to provide services. Tell us about how the pandemic has challenged your organizations. And let's start with Edie.
I want to laugh. It's been a challenge. We have 3 residential programs, and we really needed to be available to those tenants. And so basically what we did was we set up, it's called Text Now. So our case managers were able to text routinely, and the residents were able to text them. And that was the way we, at the very beginning of COVID, interacted with the residents. Our child care center, we had to kind of drop back for a while, and then we opened it up as a respite care center. And then frankly, we did a totally crazy thing. We started a school. We had kiddos from our residential settings, our permanent housing and our transitional, who, had no place they could go to school. And then we had our staff, and some of my staff said to me, I can handle being a staff person, a case manager during COVID. I can't do that and be a mom and a teacher at the same time. And I have people who handle crisis every day, and they were panicked. And so we just decided to we hired a tutor and we had 21 kids. And so that was one of those kind of crazy things. And thank God for the COVID money, because really we just did it we had no budget for that, but we just decided it was the right thing to do. So one of the things I saw was just super creativity, trying different things, making mistakes, and kind of reverting back maybe to another style. But we became pretty nimble, and we're fairly resilient in the process. So we learned a lot.
But no thought of stopping services, just trying to find an innovative way to continue to deliver.
Exactly, because people, they needed support, and we just had to figure out a way to get that to them.
How about you, Chud, at the Hutton?
Well, I'll talk from both sides. Well, our funding side, which is unique, but I want to go with a great story that came out of COVID last year, and that is the kids were locked down on our campus. Now, we have a beautiful 320-acre campus, so if you're going to be locked down, it's a place you want to be locked down, but they were restricted from being with their friends, if they do have family, sometimes visitations, they were limited. They couldn't even see the other families. We had a group of kids last year. We challenged them. We said, okay, rather than take these lemons and just stick with them, let's figure out how to make some lemonade. And a couple of the kids came together and said, we're going to put an espresso stand on campus because we're locked down and we can't go to Starbucks. And so they did an espresso. And whenever I was on campus, the other kids that were buying coffees, they bought coffee. And what that turned into was a little business. And then it spun into where they launched a coffee roasting business now that's just taken off. And so this is the resiliency the kids had that took lemons and made lemonade last year. That's the provider side. That's the fun stuff. On the funding side, we have 22 commercial properties, of which we have rental income coming from that funds about 90% of our operating budget. And we saw a major impact during 2020 on not only on our tenants challenged with lockdowns and shutdowns, and we had to make rent concessions, but we also saw an impact from the transient homeless population impacting safety, security challenges. And so that's what led me into why probably I'm here, because I'm no homeless expert and I'm not ever going to pretend to be. But from the standpoint, we had our revenue impacted last year. That was from challenges, both COVID-wise, as well as what was perceived from transient issues. And that's why I got involved with myself, property owners, Chris that's how we got involved. And we wanted to come together rather than Ben knows me too well of saying, Ben, help, I'm losing another tenant. And it's not his responsibility or Karen's responsibility. This is the providers, it's the private sector, and it's our elected officials, our government, that have to come together. And that's what we came and really pushed forward with, trying to come with some solutions, seeking some ideas from what other communities are doing, best practices that are out there, bringing speakers in, other cities in. And that's, I really think, what's led me to why I'm even represented in a square on tonight's panel.
Oh, I had no idea that was such a big part of the Hutton Settlement's funding. Just regular ongoing funding from those sources.
Yeah, and it's a unique funding. We don't take any government funding. It's 90% from rental property, and then the balance is made up between grants and private donations. But our founder endowed us the settlement with commercial real estate. So from day one, 102 years ago, we've been taking funding from our commercial real estate portfolio.
Well, I would be interested in trying out some of that coffee too, if it ever goes commercial.
Absolutely, you'll appreciate it.
Okay, Rob, I don't suppose the pandemic had much impact on you, did it?
Yeah, just a little. I think for us, the biggest thing was loss of services and space. As soon as the pandemic hit, the first thing that we had to do was reduce our shelter capacity by 50% immediately. You had to sleep head to toe, 6 feet apart, which means, the House of Charity, instead of sleeping 180 people, is only going to sleep 90. All of our shelters went through that. And so that was really hard because these are chronically homeless street individuals who didn't have any other place to go because all the other shelters were, cutting their spaces in half as well. And on top of that, you had staff who were worried about getting sick and almost afraid to come to work. We had a lot of us here in the senior leadership positions at Catholic Charities doing graveyard shifts at shelters for the first month or so after the governor's stay-at-home order, because staff were just too afraid. Their spouses were telling them, "You can't go in there; you're going to get sick." And so that was super hard. I think we popped open 5 new shelters in the first 4 months of the pandemic. We turned every place we could find into a homeless shelter. We turned G-Prep into a homeless shelter. The retreat center got turned into a homeless shelter. Several of our quarantine dorms that we built into our housing units years ago because of the norovirus outbreak at House of Charity finally got used, but none of us were happy about that. They were all filled with people. But even with that, we lost a lot of capacity, lost a lot of space, and just, the same fear that we had as citizens when this disease first hit, the poor had them also, those same fears. And imagine if you're poor and you're seeing all these people lining up at Costco to stock up on toilet paper, and you're saying to yourself, I don't even have a Costco membership. And then imagine if you're homeless and how afraid you must be already living on the streets to find out that there's this killer disease out there. And honestly, we thought it was going to sweep through the homeless population first and wipe them out. To this day, I'm shocked that that didn't happen. I'm so grateful that it didn't happen, but I can't believe it didn't happen. We thought that was the worst case scenario right from day one. But the pandemic really changed how we do business at Catholic Charities. We we learned we have to be much more agile. We have to move more quickly and be more responsive, because as communities go through crisis, whether it's firestorm or ice storm or pandemics or whatever, the poor and the vulnerable are going through those same crises, and the homeless especially are vulnerable to that.
And I don't want to go too far afield on this, Rob, but I did notice that there's now a clinic downtown that looks like it would provide some ready access for the folks you might serve. Can you tell us about that?
You're a medical clinic, or what?
Yeah,
What are you talking about?
Is it the Jazz Clinic, I think it is, or is it?
Yeah, there's a number of, the Chad's got a few clinics. We have at the House Charity Clinic right across the street from the shelter that Providence runs. That's really designed to serve that homeless population, but keep them from super utilizing the ER and the hospital. And so we can serve them in a local clinic, whether it's Chaz or House of Charity Clinic or any of the other clinics. That's a better outcome for those patients. It's also a better outcome for the hospital system. That was a big worry. The first phone calls I got when the pandemic hit were from the executives of the hospital saying, what are we going to do if 600 homeless people all get sick all at once and crash the doors at all the local hospitals? They'll take up every bed and no one will be able to get in. In fact, we held an empty building that we had just finished building but hadn't opened yet. We held it open for 2 months in case Providence needed to use it as an emergency field hospital at Schweitzer Haven, which now people are living in there. But we held that empty for 2 months because we didn't know. We thought they might need it as a mobile hospital.
Oh, thanks. Now, Karen, I'm saving you for last. But Ben and Chris, can you tell us how the pandemic affected your work? Go ahead, Ben.
I don't think anybody's really mentioned staffing, and that's a huge result of COVID is that you have openings at every agency out there trying to do work in the field. And that results in things like our federal rapid rehousing dollars, which is a really good program that has about 80% efficacy on if we can rapidly rehouse somebody. 80% of those people are still housed 2 years later and they don't enter as part of the system. They just get rental assistance. But because of the housing crisis combined with staffing problems at agencies, that, it's not just happening at McDonald's, it's happening everywhere. We weren't able to spend all those dollars. And so they had to be reallocated and some of them had to be turned back to the federal government. And then you have low-income housing dollars at the city of Spokane right now because they've got no staffing in the housing department. And so that means that dollars that could be going to build low-income housing, or for example, you have Chris come in and help out for months down at the city. And now you have Eric Finch, the director of IT, running the CHHS department because of staffing issues. So what I've really seen is the staffing problems. It's not just McDonald's closing early and having a hard time. It's the nonprofits, it's the government really having a hard time. And if you think about it, the continuum of care distributes the HUD dollars, and it was $4.3 million last year. That has stayed steady since 2013. So we have all these programs providing services in the community. This year we were able to give a COLA increase to those programs. And that was the first COLA increase since 2013. We know costs have gone up quite a few percentage points if you look at costs of private business or costs of labor, cost to build buildings, cost to have employees. And then when your government funding for the homeless mitigation efforts in the community has stayed steady for 8 years, you've got and they can't give raises then if you work for a nonprofit and accept those dollars. So it's not sustainable. And so I think the whole employee thing is something we need to continually be looking at. And that's really what I've noticed in COVID.
Thanks for that, Ben. I've got a follow-up for you with that, Karen. But Chris, tell us about how the pandemic has affected your work.
I think the biggest thing is there's positives and negatives to it. I think what happened is COVID has shown the weaknesses in every state, county, federal system there is. In which cities, there's truly, the city of Spokane, I think, handled that very well. With everybody on board. As Ben was saying, the department is pretty empty. And you've got 8 people or 7 people, I think, now running a $1 billion business for the city of Spokane. You need all hands on deck and it comes down to some pretty strong people who have heart and conviction. But with the talent pool in every agency, not just it's in the private sector, in the public sector, everywhere you can think of right now, they're kind of racing and scraping for good talent, people who are willing to work and come into to carry the torch in the mental health field, the social services field, the private industry for this particular role. You know, they've been, again, I will compliment, they have been extremely supportive. They are all very concerned. It is not about what some people might say, come to bottom line. I think the reality is this has shown the true color of what our humanity is. And you can find the goods and the bad with how people are reacting to COVID and how we're being respectful to each other, whether it's on social media, whether it's in the public, whether it's out in different areas in our homes, our own families. So I think that there's positives and negatives to this. In my opinion, the positives are we're going to be stronger as a community. And I think you're going to find the true leaders who are stepping up to really take on the challenges, regardless of the heartache you get for doing that. I think that there's more that we're going to learn from this after it's all done. And I think that once we can get past the rhetoric and a lot of the things that we need to focus on and just get down to the issues of brass tacks and focus on these issues, we're going to see a lot of better outcomes. And that's what I'm most excited about. And that's where I think the business community and the public sector can really work well with each other. You know, because I met with Rob, I talked to different folks. Everybody's on the same page. They're just trying to go in, you know, they're trying to go in directions that they are to complete the task to help the city and the county and the region. But I think the biggest thing is we have to focus on now is talent. And that is really, really hard to get. As Ben was saying, the talent pool for any of these employees you're dealing with is really tough. So that's the one negative side to it is just finding people that are really wanting to stick to the work.
That's a great point you made, Chris, about capturing the lessons learned and then applying them. You know, we always talk about that, but how often does it happen effectively? So it'd be great if we could do that. So Karen, to you, same kind of question. What challenges has the city primarily dealt with during the pandemic? And from your point of view of just the city as a whole or in your role?
Well, I will tell you what I've seen. You know, most council members, including myself, have been very lucky in developing some great relationships with our nonprofits. And there were so many of us, including myself, that it kept us awake at night worrying about how they were going to continue to function and continue to serve people. On a bigger scale, it was very hard watching great staff in community housing and human services, and they were running crazy trying to be out there. You know, we had a homeless outreach team that was trying to keep up. We had staff that was trying to get money out the door, and to watch them completely just burn out was, I think, probably one of the hardest things I've seen, to watch a department just kind of get to a standstill. And I still keep in touch with the individuals that have left, and they're all doing well. The positive for me was the first set of CARES dollars that came to the city. It was a great experience because the mayor set up a team and I got to be on that team. I was so excited. We went in and different personalities, everything, you know, you couldn't have asked for a more diverse group. And we started working on getting those dollars out, and we got those dollars out. I mean, it was quick and you could feel the passion that everybody had. Nothing else mattered but to get those dollars out. So, you know, that was the positive with me, was being able to, I probably dislike politics as much as Chris Patterson dislikes it. And so there was no politics involved in this. This was just passionate public servants saying, let's get this money out. And we did it. And the staff was working overtime to get it done. But that's what you can do when you put all that aside and you realize that you all want the same thing and you're there to help people. And that to me was a really positive after seeing some of the sadness, both inside City Hall and outside City Hall.
Well, let's stay with you there, Karen, for the next question. So yesterday, Mayor Woodward released her budget. which a portion of it, of course, reflected homeless priorities. What do you think of her budget?
Yeah, City Council's discussing, I'm glad to see money allocated for homeless. I'm more concerned about a solid plan. I think hopefully we'll be seeing more of that in the next several days. I've said for a long time that as long as I've been on City Council, we've just put Band-Aids on this problem. And it's either Band-Aids or we're just warehousing people in winter to keep them safe. And I'm just hoping that funding and some good minds sitting down and trying to put a plan around this. I hope it happens this time. It hasn't. I know Ben can offer some historical perspectives as well. I also believe that if we're going to make a difference, I think what Chris is doing is fabulous and I support it. I would hope that we could sit down and bring higher ed and our healthcare organizations to the table, because I think it's going to take those resources to put together a permanent plan. What I worry about is all this money that we approve for homeless shelters and resource centers. If you go down to the Cannon Center, it's a good place, it's clean, but people, they go in and they sit. And there's nothing there. There's nothing, there's no programs, there's no training, there's no nothing to keep them busy or keep them focusing on what they need to do to get out of the situation they're in. So I'm hoping that we'll have some funding for that. And I'm hoping that, we absolutely have to put more funding in mental health services. It's that's a big, big deal. So those conversations are starting to take place, but I am pleased to see that, it's in her budget and there's money allocated, but the devil's going to be in the details and what we can do for a permanent facility that is a one-stop 24-hour services and shelter.
So just to sum up, you advocate some type of comprehensive approach to the problem with an ongoing plan that's funded and offers a solution long-term.
Absolutely, with partnerships, with businesses, with government, with our other municipalities. The regional approach we agree with. I agree with that regional approach. I talked to the county commissioners about what I've seen in my years on council and what I think would be worth discussing. We have a resource center that a prior administration put together. It's a great resource center, but it's on 2nd and Scott, or 2nd. It's out of downtown, so it's hard for people to get to. But I think we need a model that we can track people, we can collect data, they can get services. We would be able to start trying to see what the need is and separating those that just need training or just need some positive environment to get them back on their feet, and those that don't want to do that. I mean, right now it's just a bunch of people and we're trying to protect them from the cold or the heat or the fires. We don't know a lot of the specifics in that group, and I think it needs to be something the community needs to watch us do and get involved if they want. But I think we can make that difference.
Anyone else want to jump in on that topic? Go ahead, Ben.
I want to kind of tie this back to what Chris and both Chud have been talking about, and Karen, because I think they all hit the same thread, which is, and to me, it goes back to one of the presentations that Chud's group did from Houston. And Houston made a significant impact from 2010 to 2019. The business group brought, I think it was the assistant mayor in, Chud, that was there that day. But I've been watching videos of other members of the administration of Houston, and they decreased homelessness in a 10-year period by 54%. And the first thing they did when they were told by HUD, your numbers are getting out of control and you've got 8,500 homeless individuals, sheltered and unsheltered, and it's ballooning out of control. The first thing they said was, you have to all get together and get on the same page. And that included philanthropy, it included the business community, it included the elected officials, it included the various boards, it included the nonprofits, and everybody came to an agreement. And when you do that, everybody gives up a little, but everybody gets something because you're all moving in the same direction. And they use their COC actually as their methodology for moving that forward. And in combination with that, they built 5,000 low-income subsidized units in a 6-year period and housed 19,000 people. But what it did, by them all pulling in the same direction and coming up with that united plan, I think really moved their community forward. And I just heard Karen say she's looking for a plan, but I don't think it comes from just the elected officials. It can't come from the mayor and the county commissioners and a council member sitting in a separate group called the Regional Governance Group by themselves. It can't come from the COC by themselves controlling the HUD dollars. It can't come from the city CHHS department, which is segregated and operating other dollars. And it can't come from just the business community. It's all got, everybody's got to get in the same room and come up with a formula where everybody together, including the vested interest, the healthcare, and it's got to be led by somebody that's trusted, that's not seen as partisan, that leads that and gets everybody on the same page for a community plan. Because just like Washington Trust is presenting an opportunity because they're interested in funding solutions, just like Avista in the last year and a half has offered to put money on the table, but they said specifically we need a community plan. So it's not one person's plan, it's not one agency's plan, it's all of our plan that we have to buy into. And I think really that's the first step towards a solution, is everybody rowing in the same direction, because you do get efficiencies versus the county funding source for homelessness deciding where to put dollars without consulting with the COC, without consulting with the CHHS department. And then you have agencies doing things over here. If we're all on the same page, it's a lot easier to move in the same direction and get results, I think. And I think Houston points us in a direction, and I think Chris is on the right track, I guess, is what I'm saying.
I'd like to elaborate on that a little bit. I think that Karen hit a nerve that obviously there's, when you're bringing a lot of people together, you know, the emphasis is bringing everybody together, whether it's all the community centers, the educational side, the health sciences side, the mental health side. Because if we really are talking about the issues of homelessness, we're not just talking about homelessness. There's different definitions of homelessness and types of homelessness and the types of people that need services. You have the opioid crisis or drug addiction, and then you have mental health. And I know that there is a high percentage of mental health issues. You know, I know that it's higher than probably what I'm going to say, but I'm just going to be cautious on the number. I know it's at least 75% or higher of mental health issues of the individuals that everybody is seeing on the street. And we know that there also is the drug addiction side. So the reality of it is it's a very co-occurring disorder issue. We have to deal with the things that we know is appropriate. And that is bringing everybody together. That means health sciences, that means the schools, the medical schools, school of psychiatry. All of these things take place. It's going to take time, but I know that everybody's there and their appetite is I think is on board. Everybody wants to help with this issue, and this is the time we have to operate together to come up with, as Ben was saying, a solid plan where everybody has a piece of pie at the table and they're discussing, here's what we want to focus on, so where we get good positive outcomes. So that's, I had the excitement's there, and I know the energy as well.
Chad, did you have something to add? It looked like you might have wanted to say something.
Yeah, I appreciate it. Thank you. And I want to start with, you know, from the business side, we took the approach that we have to educate ourselves. It's easy to look at it, drive through Brown Street and quickly call it out as that's what homeless looks like. We took the approach, we got to be educated. And so we spent time with the Catholic Charities, 7 other of the provider shelters touring, trying to get a sense of what is really going on. You know, Family Promise and hearing the family perspective, the Hope House, the brand new Hope House. And then we spent time talking to homeless as well, and trying to understand a little more of the why behind it. And it's complicated and it's complex. And so you start looking at this as a homeless ecosystem, that there's all these complications that are impacting it. And then we wanted to do law enforcement, understand what from the law enforcement, what are they able to do and what can't they do? And we did some ride-alongs. We're able to meet with elected officials, we're able then to go to other communities and look at what's working and what's not. Spend time in Seattle and Portland, but then we ran into San Diego, Houston, Bakersfield, Salt Lake, trying to find these best practices, and Ben shared that. And so what we've done from the group is really tried to, and I was in communications with Ben last spring, really trying to say, what is it? What does this plan look like? And I really think there's about 80% in the middle that is there. There is 80% we can agree on. That 20% we're never going to agree on, put that away. Let's work on the 20% and get this plan going. And so there's things like, and this, what we'd be recommending is, treat it like business. I'm sorry, I come from the business side and it's all about accountability, but if we can't track it, we can't measure it. And right now we're not counting. We're using that point in time count that I think is ridiculous and garbage. And in the business side, if I'm going to stock 200 cars on the lot, I know how many I'm going to sell probably that month. Right now, we don't even know what we're dealing with. And as we go into what we're going to be dealing with with the eviction moratorium ending, is it getting worse? Yeah, it's going to get worse. Well, how much? We don't know. The thing that really shocked me as we explored is when we work with the city is the HMIS program and the clunkiness to it. And it doesn't talk amongst the different providers. And so if Catholic Charities is working with a vet, does the VA know right away that they can get down there and get benefits for them, get them connected? It's clunky.
Real quick, explain HMIS real quick.
I don't know the acronym, Karen. I might have to look to you, but I know it's their information system management.
It's Homeless Management Information System.
Okay. Sorry to interrupt.
So no, and so one of the things San Diego did specifically, and it came from the private sector, is that they funded a case management system that was citywide and all the providers were connected to. So Family Promise could speak to Catholic Charities, that if there's a family that's coming into House of Charities, they knew right away that if they had a bed available, they could go. Right now, we don't even know if we have I bet right now we don't know if we have an available bed for somebody on the street that wants a bed in a shelter. That's how poor our system is. And so from the business side, those are some of the things that, we would recommend. We have a long list, mental health that Chris talked about, drug and alcohol addiction. I think law enforcement becomes a piece of this. And I think that's one that that's another complicated one because we have to talk jail, and that's not a topic that the community wants to embrace. But what does that jail look like in today's 21st century? Is it a facility that provides mental health, drug, alcohol, detox, and/or enforcement? And so I think these are things that we've looked at. I just met with Chris today talking through quite a few of these. I do think that the community needs to come forward. I don't think we can count on the mayor to bring a plan out. It becomes too political when we're expected the government to do it. So that's why I think the private sector stood in. But it all comes on the ground of what do we have in common? How do we understand each other's sectors and then begin working together? And I really kudos to Washington Trust Bank for investing in Chris and putting that investment into wanting to bring this conversation together.
We're going to come back to the eviction moratorium in a second, but I just want to go to Rob. Rob, Catholic Charities, as you said, is not a monolith. You do lots of different things. You do direct services, and you also do transitional or transformational type services for folks. Can you talk to us about how you manage that?
Yeah, really, it's a continuum for us. At the end of the day, we have clients from age 0 all the way up to age 102 and everything in between. But, there has to be, anytime you're delivering social services, you have to kind of meet people where they're at. Some people are more ready to say yes to getting help. Other people are not. And you see that in the homeless population. When we're talking about the chronic street homeless population, chronically homeless street single adults, men and women, they're broken up into lots of different populations just in that group. We have plenty of people who want to be in a shelter. They want to go into housing. They want to better their lives. They want to access services. And that's actually most of them. But there's a small number of homeless population that do not want to come into our shelters. We tell them we have a bed and they say no. We tell them we have an apartment for them. They say no. We tell them we can get them into mental health or substance abuse treatment. They say no. Their illnesses are so profound at that point, they're just not ready to say yes. And sometimes it might take weeks or months or years for that person to say yes. And that whole time they're sleeping on the streets in downtown Spokane, which is causing tremendous stress on the business community, on the economy, retail, restaurants, commercial real estate, all of it. And that creates polarization in the community where, there's people are angry. They're upset. They want to know what's going on. Homeless numbers seem to be getting worse. They feel afraid to be downtown. And those are the kinds of divisiveness that makes it hard to move forward on this. But, I do think that I love this model that Washington Trust is kicking into and leaning into. I think you have to have business owners and elected officials and providers and others all at the table. That you're going to have a big war room on this thing to get a handle on it. The good news is, homelessness in Spokane, street homelessness, chronic downtown street homelessness is a solvable problem. We're not going to end homelessness. As we're having this Zoom, someone is becoming newly homeless. They're fleeing domestic violence or being evicted or getting kicked out of a couch surfing situation or letting out of jail with nowhere to go. We're not going to end that, but we can solve it, meaning every human being should eat, sleep, and go to the bathroom indoors. And while they're indoors in a shelter, should have a clear path to getting into permanent supportive housing. We do not have a number of chronic street homeless in Spokane that's like Seattle or Portland, where it's 4,000 or 5,000 people. We have a number that it is solvable. If we have shelter beds, if we build housing that has, mental health and substance abuse counselors on site in the housing, 24-hour security, that's how we do it at Catholic Charities. If we build more of those units and have enough shelter beds, we will eventually get ahead of this. But it takes a lot of time and unfortunately takes a lot of money. And there's a lot of politically divisive and other rhetoric that surrounds it that makes it much harder. And honestly, seeing Washington Trust step in is great because they're kind of a neutral referee in this at this point. They're just looking to help come up with a solution, but there are solutions to this. This is not a situation that we can't solve. We can drop a Mars rover on a dime, 60 million miles away. You can't tell me we can't solve homelessness in Spokane. I know that we can.
Just to kind of recap there, Rob, it sounds like even though you do start off oftentimes with direct services to folks, just giving them comfort, giving them something to eat, food, or shelter, the goal is to bring them out of homelessness if you're able. Is that correct? Okay.
Yeah, I mean that the whole idea is to get someone who's on the street or in a shelter bed into a forever home where they can keep that forever home and keep their permanent supportive housing. Don't go back to the streets. Don't go back to the shelter. Don't go to jail. Stay in your housing. That is the goal. And most of our homeless clients want that path, but there are some that do not want it. And there are some that refuse to come in and get any services. And indeed, they instead choose to be on the streets, sometimes engage in criminal activity. And that really does become a law enforcement issue at some point. It's not the majority of the homeless population. It's actually quite a small minority, but they're a very vocal, very active minority. And the average person driving through that Brown Street viaduct, when they see those folks under there, they think every homeless person in Spokane is like them. And they're really not. Most of the homeless in Spokane, they want a shelter bed. They want one of those apartments that Edie or I or Fawn or whoever is going to build for them. They want that. But for the small group that don't want it and also want to be engaged in criminal activity that hurts business, hurts the economy, tourism, all of that, there has to be a solution for them. And unfortunately, that group of people is so medically ill. It's a medical issue. It's not no longer a homeless issue or even a law enforcement issue. These are people that desperately need medical treatment. And, Providence has been a great partner. So has Multicare. We also need to get them involved in this conversation because mental health and substance use disorder, if it's treated, you can do a lot towards solving downtown street homelessness in Spokane.
Thanks. And Edie, just if you could expand on that. I see your model as very similar to what Catholic Charities does. You can start off with direct services to folks, but do you try to bring them into your organization or refer them out to other places where they can receive services?
The whole point for us is really engaging. Like, how do we engage somebody? And like Rob said, one person might be dealing with a lot of PTSD, post-traumatic stress disorder. Maybe that person's a vet. And so being around people just sets them off. And so how do we figure out how to work with that individual versus someone who maybe is nearly catatonic and doesn't interact with anybody at all? So there's this continuum, and we have to continuously look for ways of engaging somebody. Maybe somebody was looking for some kind of they want to do a volunteer position. And so we've helped them find that. So there's lots of points of contact to try to get somebody connected. And we're constantly, like Rob's shop or VOA, all of us, we're always looking for that. What's that engagement piece that's going to work with this person? And it might take multiple times to do that. Some people move through the continuum really quickly. Other people, it takes years and years. And, you know, we have, like, we just saw an honor of somebody from the Chaz outreach team, Ilza. I mean, she's been doing this for 16, 17 years.
I know Ilza very well.
I know. We have a case manager at the Women's Hearth. She's retiring after 17 years, and she's helped innumerable numbers of women, despite the fact that she's kind of a badass. But I mean, she really stays with people, and they learn to trust. And that's, you know, a lot of folks, they've had their trust broken by, you know, partners, moms and dads, you know, horrible family situations. And part of our job is to try to rebuild that. I think that's one I wanted to mention, and kind of piggybacking a little bit on what Rob said. That's one thing that's pained me so much in the last few years when I hear language of the kind of rhetoric about being unworthy or demeaning language. You know, these are folks that are really broken, many of them. And most of them don't want to live like they're living. Most of them want some other option, but they don't know how. And they're often very, very sick. And so part of our job is to try to help them find that path. And so that, I mean, I saw a woman at the Hearth that would say to me, why are they saying these terrible things about me? I didn't do anything. And we just don't want to go there.
Thank you for that answer. So we're getting close to the end of our time here. We can go as long as we want, but I want to talk to the audience. We do have some questions in the Q&A box. Would encourage you to get those questions in now. I do have a couple of wrap-up questions for the group. And Chud, going back to you, you talked about the fact that the CDC's national eviction moratorium has expired. What's the state of things in Washington State?
I'm definitely not the one to ask.
No,
I mean,
okay.
I can't answer that one.
Anyone else? I think Ben or Karen might be able to do that.
I'm sorry, what was the
The
question?
eviction moratorium nationally has expired. I believe we still have a state eviction moratorium, or does that go to?
The bridge expired as well, and people have started getting notices. We're getting a lot of emails from individuals. The city has 15 million in rental assistance, new money going out, and
We approved that Monday night.
right, but
an RFP.
the problem is that money is not out the door to tenants, while eviction notices, 14-day eviction notices are being sent, and we're hearing from hundreds of people right now. I don't know how many of that will end up in evictions, but when you have a 0.5 vacancy rate on market rate apartments and no homes for sale, when you're evicted, there's nowhere to go right now. And so that's the real concern. And they may even qualify for low-income housing, but right now, low-income housing in Spokane has a 3-year wait list, the average wait list. So until we fix that, we're not going to get the current homeless people, no matter how good our transitional housing is, no matter how many services we offer in shelters. If there's no housing at the end point, we're like, and like, you can accept treatment now, but if you're on a housing wait list, say you're on the housing wait list, but you accept an in-person treatment facility for 60 days, you're then considered housed, and so you get knocked off the housing wait list. So there's all sorts of, like, you just got to get, I think, people housed so you can get them the services, whether that's mental health or whether it's substance abuse or whether it's both. But right now we're just having a real struggle with that, and I think it's going to get worse. And that may be a couple hundred more people on the streets in the next few months, and it could be 1,000. I don't think nobody knows the extent of the problem, because somebody gets an eviction notice. Some of them are calling the tenants union, some of them are calling the low income housing consortium, some of them are calling coordinated assessment at SNAP or at Catholic Charities, and we don't know how many of those are going to scrape by and find the money for the first month and then get evicted next month. I don't know if we can predict, or it could be just a blip, but I'm thinking with the housing market as poor as it is, it's not going to be a blip.
Right. So there's obviously a lot of frustration on the part of landlords that have had these properties and have not received any income for a long period of time. What would it advantage them to evict someone who could potentially pay the back rent through a city program? Why would they be motivated to evict a person knowing that?
There may be structural rules that say they can't raise rent for 6 months if they accept the rental assistance. I know Commerce put some rules that weren't on the HUD dollars that came from the federal government. I don't know if the city ever put any extra rules on, but I know the State Department of Commerce did. So if you're a landlord, it might be easier than putting a payment plan down that somebody might or not pay on. You would not accept the rental assistance dollars, evict them, and then jack your rent up by 50%. And I know of landlords that I've talked to the tenants and I've talked to landlords in that situation, and that's a calculation they're making.
So that's Council President Beggs is working on some legislation right now that he's passing around for input. That's very close to that. The other thing I'll say too is that early on, we've had a landlord tenant work group that has tried to address these issues and, you know, talk them through. And I will say, I think Spokane is so lucky that our mom and pop landlords have really been supportive and have really been, for the most part, patient and giving their tenants, they don't want to lose their tenants, you know, giving their tenants breaks and waiting for that money that comes in. The money that the city is putting out there, I think it's about $1 million a month in the rental, you know, getting rent out to landlords. We've got to do it faster. And
Is
with
it enough? Is that enough money?
We passed, huh?
Is that enough money?
Well, and we've got more coming. So I'm hoping it is, but like Ben said, it's gotta, we can't slow this down. We've got to get it out there because people are scared and they should be. So that's really frustrating, but I do have to put a plug into our mom and pop landlords here in Spokane. We've had good luck. We've had good feedback. We've had good support from them. And it's very much appreciated right now.
Be interesting to see what Councilman Beggs is able to come up with. He is a problem solver, in my opinion. So this is the last question of the night. It goes back to one of the more interesting things you all talked about, a long-term comprehensive solution to homelessness in this community. The solutions you offered were a partnership between elected officials, the private sector, charity. How do we get that rolling? And is it what's stopping us from doing that? Anyone?
I think it's the unbiased person coming forward that has, there's a very wide variety of opinion on this, and the discussion has taken a harmful turn over the last 3 or 4 years. So it has to be somebody that's trusted by everybody in the community, and starting from scratch and coming up with a plan and then going and selling it's not going to work at this point. It's got to come with everybody sitting at the table together, developing that plan. And I think that's the first step. You have to get all the funding sources agreeing on that end state and how to get there. I think that's the first step, honestly.
Yeah, money's always an issue. Budgets are always tight. I know you folks have all had some CARES dollars come in, and they were heaven sent at times when it was hard to continue your normal fundraising. But money's always an issue for nonprofits. I'm on the board of 2, and it's always an issue. So yeah, I appreciate that. Any other thoughts on that? What Ben said, Chris, maybe you?
Yeah, I think that the biggest thing is, you know, I've always disliked when social services, child welfare, any of those things turn into a hostage for a political debate. In my opinion, they're not political in nature whatsoever. We're responsible to be good stewards for our future legacies, which is the kids in schools, because someday they will be the ones here on stage talking, and not, at least that's the hope. So my opinion and my thoughts are is check your egos and politics at the door. and let's focus on the task at hand and not get sucked into the minutia or the drama. And let's just really be performance-based so we can get it done, because we will all win and have a better product at the end of the day. We'll all walk away with something that we put into the table, and at least be happier with the end product, so that we know we can feel better that what we're doing is going to be, worthwhile.
That's a great perspective and also a tall order. Before we go to the Q&A, does anyone have any closing thoughts they'd like to offer before we start taking questions?
I'd just say it's a solution-oriented community. We've come up with lots of great ideas over the years. Just look at, Expo, and look at the downtown area, the parks in their community. So I think we can do this. It's just, I think we're right about putting our egos aside, but being willing to really look at all the ideas with and not be critical at the get-go. This is a brainstorming, and we need to look for really creative opportunities.
And just to add to that, I think both Chris and Edie are right on. Years ago, my mother was involved in Expo and helped the fair, the whole thing. And I remember asking her at one point, how did you do this? And so she would tell me, and then I'd say, well, you must all have liked each other, because it was business and everybody in the community involved in this. And she said, no, we didn't always like each other. We had a goal, and we knew we were working for the people. We were trying to get all of us on the same page for this project to get this done. And I think that's where we need to be. And we need to have voices in City Hall that can stand up and say, we're going to do this, and we're going to partner with, start with your municipalities standing up and start meeting with people. But I think it's strong leadership and a strong statement that we are aware of the problem. We have tried very hard to communicate with people, but now it's time to bring people together and to create a permanent solution for this, and that we are listening. But I think those are the kind of voices we need to stop kind of not wanting to make people angry. This is an issue that we need to just hit head on, and we need our voices to do it and to bring people together.
That's a great perspective. Thank you. Anyone else before we go to the questions? Rob, anything? Rob says no. Eric, if you have a question for the group?
Yeah, great discussion. So just a reminder, we'll get to as many as we can. Some have already been answered, which is great. That's the first time any of our panelists have done that. That's really efficient. So if you go to the Q&A feature, you'll see some that have already been answered. And Mark and I will just go back and forth. First one from Jim says, and this is especially for Karen, has Spokane explored the idea of tiny home communities as a type of transition housing, perhaps on city-owned properties?
Yes. And if Ben remembers this, it was probably, I had groups of individuals who were manufacturing the homes, the tiny homes, and we had great hope that would be an alternative for folks transitionally before they either went where they needed to be or could stay in their homes. And we had looked at land within the city. And I will tell you, if anybody wants to pick it back up, I have all the information on it. At that point, it was a different administration, and it just didn't go anywhere. And that was the frustration, was getting all the information, working, trying to get things, people educated on it and what we could do. And there were at that point 2 or 3 groups that were wanting to make these tiny homes and get them out there, but I couldn't move it into the administration where they were willing to act on it. But I know 2 folks are still out there. They're doing some interesting things in the valley with, I don't know if they call them tiny homes, but they're the smaller homes but we had talked about working with churches, with church properties, that organizations that have extra lots, that you could put tiny homes on that. You could work with a nonprofit to manage the area where you have the homes. It we had all sorts of great ideas, and I'm happy to pick that up whenever we need to, but I couldn't get anybody too interested on the administration side when we started that.
So just to piggyback on that, for the group, you're familiar with the phenomenon NIMBY, not in my backyard. Do you ever encounter that in your work, Rob?
I could write a book. Every time we try and build something, there's a list of people lining up to sign petitions, protest, or sue me. So, I think the tiny home is a perfect example. That the best place to build a homeless shelter or housing for the homeless is somewhere else. That's the reality. That's true all over the U.S., not just our community. And one of the reasons the tiny homes never went anywhere is because you couldn't get through all the zoning regulations and all the restrictions. And it's real super easy for the average citizen to find something in the code that'll block a tiny home or a new shelter or new housing. And if there's nothing in the code, then here come the lawyers or the petitions. People get really angry about anything to do with the homeless being built anywhere. And it's understandable. It can be a scary premise for a business owner, a real estate owner, a residential owner, but it's definitely a real phenomenon, and it's probably one of the biggest reasons that keeps us from building not just housing for the homeless, but just affordable workforce housing for the working poor. We need more units of that than we do for the homeless. There's only probably a couple hundred units needed for the homeless. There's thousands needed for the working poor, low income working families who have nothing to do with homelessness or mental illness or addiction. They're just the working poor. They have nowhere to live either. They don't have apartments either. They're doubling and tripling up. They're couch surfing. And that's the kind of housing that also gets blocked by local governments or county governments or lawyers or loaded up angry neighbors. They don't want any of the housing for those kinds of people anywhere near them. And that's true all over the country. And we're going to have to take some intentional work on this topic if we're going to solve homelessness. The only way you're going to solve homelessness is to build more housing. And if you've got a community that is fundamentally against building more housing for those people, then you're going to spin your wheels. It used to be we could find dirt anywhere to build Catholic Charities housing. Now you can't find any dirt that's zoned correctly. We had to set up a separate corporation that doesn't have anything to do with our name so we could make offers on land without people knowing it was us. Because as soon as they found out it was us, it was a disaster. The price went doubled, and here come the lawyers and angry NIMBY folks. So, it's a problem. It's got to be solved. And unfortunately, the only place to solve that really is in some of these planning commissions and city and county codes for zoning. And if you solve that, then you've got a lot of developers in this town, for-profit and nonprofit, who would love to build housing. There's a great return on investment building apartment complexes. Ask people like Harlan Douglas or Fritz Wolf or Darren Davidson. They've made a lot of money building these apartments, and they would love to build more, but you can't find a spot to build them where somebody or some government agency isn't going to stop you.
And I see.
Go ahead, Eric.
Yeah, I just wanted to give a plug for, I don't know if you guys are aware, our forum last month, and the video is up on the PEG website, was on this topic. And we had a really lively discussion, and zoning laws were discussed at length. So I encourage you, if you're interested in this topic, on the PEG website under videos, last forum, we tackled the affordable housing issue. Go ahead, Ben.
Well, this is really a state caused problem though. We said as a community, we wanted a growth management act that restricted us from spreading out, which is good in theory, but an unintended consequence was they said cities can do whatever you want. And cities and NIMBYs said, no, we don't want to go up and densify. So you've then constricted yourself from going up, and you've constricted yourself from going out. And so then you end up with rents rising by 30%. So the state really is going to have to act and mandate density to go along if they want to keep the GMA. Otherwise, we're going to continue to have it and fight these battles one by one, which is quite exhausting. And you can see we're in a housing crisis, and 4 members of the council voted against 2 comp plan amendments going forward on apartment buildings. So the 3 that supported it were overruled, and those didn't even get to go forward through the process. And that's during a housing crisis with rents rising by 30% every year. So we've empowered our neighborhoods. In 1995, the city put the neighborhood councils in the charter, and that gave them an inordinate amount of say. And those are the exact people that have all the time in the world to show up at every meeting and tell you how they don't want density in their neighborhoods, because they don't want those people. Because yeah, it's not just homeless people they don't want people with lower incomes. They don't want mixed income neighborhoods. And until we fix that, we're going to have a real problem.
And I will say that where council is working on, in fact, I think it's coming up in a couple weeks, the ADUs, the attached dwelling units. We put together some nonprofit developers and some private developers to talk with about zoning and what we need to do to change some of those restrictive laws. And I think Ben's been part of some of that. So we're getting there, but it's been a slow process.
Yeah, but are you going to get rid of the owner occupied requirement? Because the only cities that have seen their permits increase, like we had 12 permits, but Portland, when they got rid of the owner occupied requirement to build an ADU, saw a 500% increase in permits. So like we can play around the edges with ADUs all we want, but until we get rid of the big problem, which is you can't require them to occupy the owner to occupy the building to build an ADU. It's absurd. You should be able to have 2 buildings on your land.
I believe that has been taken care of.
Okay, that's the big one that'll make the difference. It's done
Yeah.
in other cities.
And then Councilmember Kinnear is bringing one forward with I can't remember, with
She
some
was
tips.
getting rid of the permits if it was near a center and a corridor, but that's,
Yeah.
I guess what I'm
But
saying is
also-
that's playing around the edges, and you won't see
Right.
any increase in permits unless you
Right.
deal with the owner occupied requirement.
I will keep you posted on that because I believe
Okay.
that that's been covered.
That's fairly in the weeds. I apologize.
Eric, have you got a question?
Yeah, I got Karen. This says for Karen. What is the council doing? And you've said some of this, so maybe just tell me if you've addressed it. What is the council doing now to address zoning and other requirements that prevent our community from constructing more needed housing? Antiquated ways of thinking about restrictive single-family zoning are not able to address our current housing needs. What is the council working on to address this?
I think I discussed most of it. We are looking at zoning issues. I will tell you, this last week I spent with the developer who's going to be developing some housing on North Monroe. And my first words out of my mouth when I meet with these developers is it's got to be affordable. So that at least some of it has to be affordable. That's exactly what they're doing. We approved the MFTE, the multifamily tax exemption for them. So, I think council as a whole is really trying to get there. And we are meeting with planning. It would help if we had more planners and a planning director, but we are having those discussions. And so we have a developer right now in my district that's going to be putting multi-family housing on Monroe and then up on Garland. And, I'm there to say yes, but include the neighborhood councils and make sure that your neighborhood's behind you. And you're going to go a lot further getting buy-in from everybody. Edie can talk about what they went through just up in Northwest by my neighborhood to put in those cottages. And it took almost an act of God 2 years to get people comfortable with having those kinds of housing, that housing variety up there in that area. So council is working on it. We're having those discussions and we're trying to move them forward as fast as we can. And the first one up is the ADUs. So we'll see, but there's some great housing conversations going on North Monroe and up in Garland. So that's a good thing.
One of the things I think about for potentially transitioning the US's demographic or way of living is group living. How do we get to that?
So I'll just say in West Central, we have a young man who owns a lot of the older, bigger homes in West Central. I'm thinking you're talking the boarding type home, where he's been very successful. He rarely has to look for tenants because once they come, they stay. What he will say is that's almost a full-time job. You have to have somebody on site full-time because it just requires a lot more, but he's very successful. And he has probably 3 or 4 big homes that I think anywhere from 5 to 8 people live in at a time. He's been very, very successful. And West Central, they do not have a problem with that type of housing at all. It's been a very positive thing. So we do need more of that, more options.
There's been some good experimenting in Spokane on co-housing, which is a similar idea. And also a lot of people, when we built our cottages, a lot of seniors felt like that was a really great idea for senior living. You had your own unit. The cottage housing ordinance in Spokane requires it's 1,000 square feet or less. But you were in a village of supportive people. And sometimes they even will be built with a community building with a kitchen, or even co-living in terms of meal preparation. So there's a lot of really creative ideas out there. There's a housing program for vets in Florida that uses tiny houses, and those are in the woods because a lot of vets are dealing with PTSD, and they're more comfortable if they don't have to see each other. So there's lots of great examples out there. It's just some of the zoning issues that Ben's talked about and Kieran's talked about, we've got to address or we'll never get there.
I'm going to ask a question. Ben, you already answered it, but it comes from one of our members, Aruna. Is there a possibility of buying older hotels which have rooms which could provide housing and then maybe having some support on site for folks?
Catholic Charities, the Washington State Department of Commerce has a grant out right now. Catholic Charities applied for one 16-unit hotel, but the answer came back that they were asking a little too much, the seller of the hotel was. So we went and looked at another one on down by the hospital that had 153 units and would have provided some permanent supportive housing, but a lot of housing for domestic violence victims, refugees, and also the ARC needs housing because their market rate housing is going away. But unfortunately, the owners of the hotel only wanted to long-term lease it for a prohibitive cost instead of sell it, which the grant would pay for. So what we're really looking for is if somebody had another 100-room hotel, if there's another round of funding, I think Catholic Charities, and I'm not going to speak for Rob, but I'll speak for his housing guy because I talk to him every day, all day long. Poor Jonathan. But I think that there are agencies in town that would be open if we found another one and the sources came open. It's a model that King County seems to have figured out. We just don't have a wide variety of hotels to choose from that we could buy with that grant opening right now. But there is need for it.
Good. And I just want to make you aware, Chris Patterson messaged me and told me he had to jump off to get his daughter to bed. So that was good. So we're nearing the end. I have a couple more questions. How many do you have, Mark? I was going to try to squeeze a few in.
No, I'm done. Go ahead.
So earlier, one of you, I think maybe it was Ben, said that, in order to organize all these various stakeholders, we need somebody the community could trust, that everybody trusted and respected. Does anybody on here have an idea of who that person might be? Who could fill that role?
I got to say, Sandy Williams from Carl Maxey Center, she facilitated a housing mayor's group on housing under Condon. She's very well respected and also brings in that BIPOC perspective. So a lot of people adore her.
I agree.
I would add, I'm just going to add it. I don't have somebody in particular, but through the education journey, because I'm not coming from your perspectives and your expertise in this area, but I did take with a group, try to go provider by provider and then sector by sector, whether it's law enforcement, government. And I will tell you, it is so siloed And there are within the providers as well as between law enforcement providers, between government, admin, council. And I think there's a point where we got to educate ourselves as a community to come together and understand from the different perspectives of what each sector is, because until we do, our eyes aren't open. And I think that we have a ways to go on that education journey. I think this is the kind of venue here you're doing tonight that needs to happen. But I will tell you, when we're coming from the provider side or money, where money's driving it, there's a lack of trust, say, from my perspective, like, are they in it for the money or are they in it to really solve homelessness? So I think as a community, we have a ways to go on education and empathy towards each other sectors. And whether that's one person that can solve that, it's not the mayor, I know that. And I will tell you that it's not council, we can't, and I'm not saying that in a bad way. I'm saying that somebody, and that's why I'm proud of Washington Trust for stepping up. It might be them, it might not be, but when I went through that educational journey, there was too many silos out there that aren't just not talking to each other, but they're protecting their own little area. So that's my perspective. I know that's not a popular comment, but that's what I learned.
Okay. Before we get to the last question, I have one more question. I'm going to do my little plug for PEG. As you guys know, we're a small grassroots organization with shallow pockets. So if you're finding these forums helpful, and again, I want to draw your attention to the one on affordable housing last month. It's on our website, www.pegnow.org. But please also consider becoming a member. We rely on membership dues and donations to cover these costs. So on behalf of the PEG board and membership, we want to thank all of our speakers for taking time out of your nights. Hour and a half is a big commitment on a weeknight, so we really appreciate that. And also thank you to the audience. You're the reason we do the work, and it's why we exist. So a video of this evening's forum is going to be posted on the PEG website in a couple of weeks. Please mark your calendars. We have a really good one in December to join us online December 15th, 7 p.m. For a forum on U.S. foreign policy with China, hot topic right now. Our speaker will be Governor Locke, who is a former U.S. ambassador to China and also a former Washington State governor. We'll send out a flyer with the Zoom link for the December forum later this week. So I have just one more question. PEG is about solutions and civility and dialogue and trying to fix things. So what can people do? We get that a lot after forums. They say, well, what's the call to action? What can people do that care about this issue? What can they do to be a part of a solution? That's to anybody.
I would say oppose NIMBYism in your neighborhood and strive for accepting all types of incomes in every neighborhood in Spokane. I would be advocating with the county and the city to fund housing and homelessness solutions with the $180 million that there is in ARP funding. And I would continue to push everybody to coordinate and come up with a plan that's a community plan that everybody can buy into.
I would also say maybe if you're a person of privilege like I am, take a little time and maybe spend some time at the Women's Hearth or at House of Charity. And I think you'll start realizing that we tend to other people like they're not like us. And in fact, they're very much like us. And I think getting through some of those perspectives would be really helpful to changing the way we look at each other.
Okay. Well, Mark, I'll turn it over to you. Thanks, everybody. On behalf of PEG, audience members, thanks for coming. Please check out our website. Mark, any parting thoughts?
No, just a great thank you to the folks who participated tonight. We do appreciate taking the time to really shine a light on a huge issue in our community. And I know it occupies your minds on a daily basis. So we just thank you for sharing your perspectives with PEG's audience. And with that, unless you have anything to add, we will say good night. Good night.
Well, so much.